Thank you, Moritz, for this kind introduction. Good morning, ladies and gentlemen. So, MR imaging of the hip is mainly two-dimensional, unless you work with Dr. Potter at the HSS, where you get nice 3D segmentation from MR, or when you use a CT scan for 3D segmentation of the bone. So there's a lag about 3D segmentation of MRI, and that was our aim to develop and to validate an algorithm, a computer algorithm powered by deep learning or artificial intelligence that allows for automatic segmentation of bone, cartilage, and labrum using the MRI, which then would be a powerful tool for morphologic evaluation, including biochemical analysis using the 3D-MRI sequence. We were lucky, we got a grant from the Swiss National Science Foundation. It's a 4-year project which started last year. We got a finance from about 600,000 Swiss francs, and it involves 2 theses for PhD students. There are many partners, clinicians, radiologists, the PhD students, and of course, computer scientists for this project. You're using AI every day. When you open your phone with Face ID, when you follow social media, when you go on Google and when you search, you are using AI. And there are other AI tools online like ChatGPT. You can ask them questions and they generate text for you. I tried it yesterday. Give me a glimpse into the future of orthopedic surgery. It's the title of tomorrow's key session in the afternoon. And then it comes up with an answer, and the answer about the future of orthopedic surgery is it includes 3D printing, augmented reality, robotics, and AI. And this is all going to be covered in tomorrow's session. And best of all, the future of orthopedic surgery is exciting and holds tremendous promise for improving patient outcome. Isn't that great? You can do other funny stuff. You can go to DALL-E, and you can ask for a picture of the Bundeshaus in Bern with a waterfall in front of it. And it generates a new picture which had not been existing before. You can check it out. You can go to the Bundeshaus tonight, but don't be disappointed. There is no waterfall. Or you can use it in more serious ways, in medicine in general, and you see that it's used more and more, especially in the past few years, there's exponential growth in the use of AI in medicine. Our MRI protocol for the hip includes contrast agent in the joint. It's an arthrography. We use the radial sequence to evaluate labrum and cartilage, the intra-articular structures. We also use the 3D-MRI sequence for biochemical composition of the cartilage, and the wiped Dixon sequence for the bone, for the entire pelvis, and also the distal part of the femur. With this algorithm that we developed and the wiped Dixon sequence, we are now able to automatically segment bone out of MRI. We don't need the CT scan anymore. We are using currently an algorithm which was specifically designed for biomedical imaging and segmenting images. It was developed at the German Center of Research for Cancer in Heidelberg, and it's actually open source and you can download it from the internet. It's not as easy. You need computer scientists, they need to tune it, and you need to train it. You have to input the AI so-called labeled data for supervised learning. What's that? You want the AI to distinguish on the MRI between bone and soft tissue. It's not as easy as on the CT, so you need expert readers. They do a lot of work. They do all the manual segmentation on the MRI of the bone, and that's the basis for the supervised learning of the AI, so it learns how to distinguish between bone and soft tissue. And of course, it needs validation, thorough validation. So there were MRI data from 80 patients. With 80% of these 80 patients, the training of the AI was performed, and the other 20% was used for validation. This validation was performed 5 times, and each time another 20% of the data was used for validation, and finally the training with the best network parameter setting was used, and then again tested with so-called unseen data to have true values, how good it works. And of course, these algorithms, they are very specific for an MR machine, for an MR sequence, and therefore we took data from another 40 patients from Austria, with another scanner and even another MR sequence to test again this algorithm. How do you test 3D segmentation? You know the ICC if you do some continuous parameter measurements, but if you want to compare 2 shapes, whether they're similar or not, the automatic segmentation and the manual segmentation, you need other parameters. There are a multitude of parameters. One is called the dice coefficient, and it tells you how much the 2 shapes fit. So let's say if you have the yellow and the blues square or ball, and they overlap about 50%, you get a dice of 0.5. That sounds very logical. So the higher the dice, the more overlap there is, and if you want to have a perfect fit, the shape of the two shapes have to be exactly similar to have a dice of 1.0. Here are our results. For automatic segmentation of the bone using the MRI, and the dice was almost perfect, astonishingly good, 0.97 for the pelvis and 0.98 for the femur. There are other parameters to describe this validity of the automatic segmentation. One is called the mean surface distance. That's probably a little more to understand how accurate this can be performed. And the mean surface distance of these 2 pelvic shapes was less than 1 millimeter. For the pelvis, 0.3, and for the femur, 0.2 millimeter. So automatic segmentation of bone can be reliably and accurately be performed. We're actually using it in the everyday daily clinic. For example, we're performing automatic motion algorithms to check range of motion in more complex hips. That's an example. There's still a gap. MRI can offer more. It's not just the bone. Then you could do a CT scan. Therefore, we aimed and we trained our algorithm to segment also the labrum and the cartilage. And again, of course, you have to validate it, but the values for the mean dice are quite similar for cartilage. It's more difficult to segment, however, the labrum, but it's still a good mean dice of 0.82. And the corresponding mean surface distances are 0.3 and 0.4 millimeter. The external validation, so we took MRI data from 40 patients from Austria with a different sequence, a trophy, so-called trophy sequence, and the algorithm has never seen such a trophy sequence before, like me. But then we run the automatic segmentation, and there's astonishingly good results. It's 0.9 for the cartilage and 0.7 for the labrum. And there's a chance to give it a little bit more training with the new sequence to have improved results. So it even works with an MR from another institution. So now we have a tool. We can evaluate lots of amount of MRI data. We can segment not only bone, but also the cartilage and the labrum. We can perform studies to do the detailed anatomical comparison. These are just 3 examples. You see the hypertrophic label in dysplasia, and for example, the smaller labrum of a protrusion hip of the right side. But also you can measure cartilage thickness. You can measure orientation in space regarding anatomical landmarks of the pelvis. You can measure cartilage thickness by segmenting the cartilage, which usually without an algorithm would take hours just for one case. And then you can topographically compare differences in cartilage thickness. You have heard a lot about the ischemic. For me, it was always very difficult to understand. But as far as I could understand, you have cartilage degeneration. You lose these proteins called the glycosaminoglycan, and they get replaced by the gadolinium contrast agent, and this affects this T1 relaxation time, and you can also measure it. And together with the automatic segmentation, you can also do this segmentation of the cartilage and show where the degeneric values are high and where they're low. And we actually found very high topographical differences regarding these degeneric values, even in normal hips. We also trained it to quantify the amount of necrosis in hips of AVN, and you see there are many more tasks you can ask for the AI. We could show that the AI-powered algorithm can perform reliable and accurate 3D segmentation not only of bone, but also cartilage and labrum. In general, algorithms will be increasingly be applied in healthcare, hip surgery, and orthopedics. And AI tells you the future of orthopedic surgery is exciting and holds tremendous promise. Thank you.